Hi, everybody. This is Jackie Schwartz with Planet Einstein. Today, we're meeting with Chris Harlow at his location on
St. Matthews Community Pharmacy. It's on 3922 Willis Avenue here in St. Matthews.
And today we're going to be talking about two main topics. And first, we'll cover integrative pharmacy and what that is all about. And secondly, we'll cover Chris's passion, which is geriatric pharmacy, and find out a little bit about why that's a good thing as well and how it might help the seniors in your family. So, Chris, how did you follow this path and what led you here to a community pharmacy?
Well, it's really an interesting story. I think whenever we start our pharmacy school curriculum, it's overwhelming with all the different opportunities there is in pharmacy. I mean, certainly you can go into the hospital side, you can go into the community side, or the retail chain pharmacy side. But I really wanted to have a path where I worked directly with patients, had that patient-to-patient interaction, and I could really have an impact on the community, that's what ultimately led me to the independent pharmacy practice.
And in reading your bio, which I found really interesting, by the way, Chris, good job of putting that together. It said something about your family and your mom having died during pharmacy school, which was sad, but that was obviously an influence on your being destined to be a small business owner. Is that right?
Yeah. So, I grew up in a very humble background. I mean, my parents are blue-collar workers, and so it was always a passion of my mom's to have a small business, but we never had the means to do that. So when I started pharmacy school, I toyed with the idea of having independent pharmacy, but never thought it was possible. Didn't really know the opportunities available. And she did pass away, unfortunately, during pharmacy school, so she can't be here with us today and see the accomplishments that I've had. But she would certainly be proud.
I'm sure she sees it. So let's talk about integrative medicine first, or integrative pharmacy. What is that?
So that's a great question. I think it's always on everyone's mind. What is integrative medicine? What is integrative pharmacy? The best way to explain integrative pharmacy is we have a traditional training model in both medicine and in pharmacy. And in that we learn about how to prescribe medicines, how to treat the symptoms of an illness. But what integrative does, it takes a more holistic approach to care. So we actually start looking at how can we treat the cause and not just the symptoms. One example for looking at the integrative or natural treatment approach, particularly in the world of pharmacy, and what I look at as a geriatric pharmacist is drug nutrient depletions. What that means is we take medicines that are depleting vital nutrients in our bodies, and so I will actually do a medication review and look over the medicines and see if there are any supplements that you could take to help achieve an overall wellness. So again, we're in the integrative pharmacy, integrative medicine world. We're not just looking at the symptoms. We're looking at how did we get there? What is the cause of those symptoms? And if you do have to take medicines, what supplements can you take to help achieve an overall wellness?
We did that personally. My husband Max came to Chris and reviewed his medications and gave him a path to follow that included integrative medicine by including some probiotics and vitamins and other things that might even help him get off of some of the medications. So that could be a goal for you too. So you have two locations, right? Where are they?
So our first location that we opened up in 2011 is in Norton Commons. That's called Commons Community Pharmacy. And the second location we opened up in 2013, and that is the location here at St. Matthews.
And he will come to you as well. There's a program available that Chris makes house calls.
Yeah, so that's called our Pharmacist at Home program. It's also, if you look on our website, it's under the Concierge Pharmacy. And what that entails is I may get a referral if you decide to call, or your loved one call me, or I get referrals from physicians or home health nurses or caregivers. They will call me and set up appointments where I can actually go to your home, sit down with you, and go over all of your medications, with the ultimate goal of helping you achieve more of a long-term health status and helping you achieve greater understanding of your medicines and helping you with your medication organization. Because what we do is we will then, if you're interested, enroll you in our weekly program. We come out and do weekly visits. We'll bring all your medications to you already organized, prepackaged, ready to go. We work with you and your doctors to make sure that everything is appropriate. I use the integrative medicine approach, so we'll talk about supplements. Are you on the right supplements? But really, we work with you and your doctor to make sure that all of your medicines are appropriate for you and help you better organize your medicines.
So bottom line is, this is the way pharmacy used to be. Your pharmacist was a friend, was there in the neighborhood for you to get to know, and they knew what you needed in terms of medication. So Chris is bringing that service back. It's personalized, it's, as he called it, concierge. So come visit and get to know Chris. Use his service. If you're the caregiver of a senior, this is something that will be invaluable for you. So thanks for watching our video today. And Chris, thanks for being with us.
Well, thank you for having me.
And we'll see you in the next video, everybody. Bye-bye.